Hi, my name is Jasmine Albert, and I am a fourth semester nursing student at Southside College of Health Sciences. Today I will be presenting my project on Nursing Management Prioritization and Collaboration Project. Introduction and Patient Information. Ms. Doe is a 90-year-old DNR female admitted on the 16th of February from home with weakness and inability to walk. Her diagnosis is an ischemic stroke. Ms. Doe has been evaluated by speech therapy and is on a honey-thick, full liquid diet. Ms. Doe has a consult with occupational therapy today due to a decline from her baseline functioning prior to her stroke. Collaboration with rehabilitation therapy is important for this patient to provide the best quality of care and is key to a positive prognosis for the patient. Overview of rehabilitation therapy. Rehabilitation therapy refers to evaluations, interventions, and treatments that help patients regain function. A rehabilitation therapy team comprises of physical therapy, occupational therapy, and speech-language pathology professionals, all of whom work together to provide care to patients whose lives have been affected by disease, injury, or disability. As a team, therapists help to address impairments in patients' ability to move, speak, eat, walk, dress themselves, and otherwise participate in their normal daily lives. OT versus PT versus speech-language pathology. Occupational therapy. Occupational therapists are health professionals who work with people who've had illnesses, injuries, and disabilities that prevent them from participating in their normal daily activities. OTs work with these individuals to help them regain agency over their own health in various ways, including helping them with cooking, bathing, dressing, toileting, and more. In some cases, that involves using assistive technology, or it might require providing splinting, bracing, or other devices. Physical therapy. Physical therapy is the treatment of the effects of disease, injury, and disability by using exercise, manual therapy, education, and therapeutic activity. PTs are considered a conservative care option because they use such technologies to get results, rather than relying on medications or surgeries. Physical therapists' primary goals are to help patients improve their movement and function and also reduce their pain. Physical therapists often prescribe stretches, exercises, and functional mobility activities to help patients move more efficiently and effectively while eliminating as much pain as possible. Speech therapy. A speech-language pathologist's goals is to improve a patient's ability to communicate and/or swallow. Speech-language pathologists can work on many aspects of communication with patients, including speech production, fluency, language, cognition, voice, resonance, and hearing. Swallowing evaluation and treatment can also include feeding. Speech-language pathologists work with individuals across the lifespan and with a variety of diagnoses ranging from stroke to autism spectrum disorder to head and neck cancer to traumatic brain injury. The services provided by speech-language pathologists can be either rehabilitative, helping patients to regain what they have lost, or habilitative, helping patients to maintain or improve communication and/or swallowing ability. Indication and therapeutic outcomes. My patient was referred to PT/OT due to a decline in his routine function prior to the stroke. Therapeutic outcomes for my patient include maximize the quality of life for the individual, address the individual's specific needs, assist the individual with adjusting to an altered lifestyle, be directed towards promoting wellness and minimizing complications, Assist the individual in attaining the highest degree of function and self-sufficiency possible. Assist the individual to return home in the community. The nurse's role. The nurse controls environmental factors, including a safe environment in the patient's room, patient comfort, lighting, noise level, and room temperature. Frequent neuro assessments and monitoring vital signs. Directs personal care of the patient, manages medications, is responsible for assessing and maintaining skin integrity, helps with activities of daily living and adaptive devices, informs the team about the status of the patient, and educates the family and patient. Occupational therapist role. Assessment screening. The occupational therapist will carry out a comprehensive assessment of the patient to identify any impairment caused by the stroke. Depending on the patient's needs, assessments can include analysis of daily living activities, the home environment, adaptive equipment, which can help patients to complete daily tasks, assessment of cognitive components, and screening of sensory skills such as vision and hearing. During hospitalization, occupational therapist's role will be to design a program to help the patient regain their independence. This might include practicing getting dressed with their weaker arm or learning to compensate for visual disturbance. Improving the ability to perform personal daily living activities such as grooming, hygiene, dressing, and eating. Improving the ability to perform domestic daily living activities such as hot drink and meal preparation. Improving the ability to transfer from bed, chair, and toilet and to become mobile. Also includes fall education. Upon discharge, occupational therapists have a good understanding of the match between the patient's needs, abilities, and the environments in which they need to function, which assists with the successful transition to the home, community, or next level of care. In spite of short length of hospitalization in the acute care setting, occupational therapists play an integral role in starting a successful rehabilitation process. They also recommend home safety modifications and durable medical equipment as part of an effective discharge plan to support functional performance. Interdisciplinary teams. Interdisciplinary teams collaborate to identify individuals' goals and is characterized by a combination of expanded problem solving beyond discipline boundaries and discipline-specific work toward goal attainment. A collaborative rehab nursing dynamic can work especially well with occupational therapy interventions and self-care retraining, since nursing care inherently involves daily physical assistance with self-care tasks. Occupational therapists can, for instance, schedule treatment sessions incorporating self-care activities during a time when nursing staff would typically assist the patient with the same activities. Further, if OTs focus on a particular self-care goal on which to collaborate with nursing, independent performance of the skill can be facilitated during routine nursing care to reinforce gains and strategies acquired in therapy. Community health resources. Inpatient rehabilitation centers typically offer types of therapy along with medical nursing care provided by a multidisciplinary team of rehabilitation professionals in a hospital-type setting. Outpatient clinics vary in the type of therapy they offer, and those services are offered by appointment with patients traveling to their offices for therapy sessions. Home-based rehabilitation programs typically offer a few basic skills, usually physical, occupational, and speech therapies, in patients' homes with therapists visiting by appointment. Community health resources are significant because acute care settings are meant for the purposes of stabilization. Once a patient has stabilized, community resources provide a way for continued therapy based on the client's needs. Maslow's prioritization principles and plan of care. Prioritization of care in order of importance. First, respiratory. Maintain airway and prevent aspiration. 2, Neurological. Assess level of consciousness and vitals frequently for worsening of condition. 3. Cardiovascular. Monitor telemetry box for dysrhythmias and set up DVT interventions. Nutrition. Honey thick, full liquid diet. Musculoskeletal. Maintain optimal function through range of motion exercises and positioning. Integumentary. Prevention of breakdown through assessment and careful care. Gastrointestinal. Prevention of constipation. GU. Prevention of skin breakdown related to incontinence. Nursing plan of care for the day. After being seen by the occupational therapist, an order is written for the patient from OT to have range of motion exercises, repositioning every 2 hours to prevent skin breakdown and contractures. Patient is a total care patient. Keep head of bed elevated to reduce risk for aspiration, bed alarm, and fall precautions. The nurse's day will be affected because the nurse will have to figure out how to fit the patient's OT needs into her nursing care during the day. In order to do this, she will have to manage her time effectively and delegate appropriate tasks to the UAP and LPN. Okay, everyone, that concludes my presentation. Thanks for watching. If you have any questions, please feel free to ask now.